Okay.
Did it record?
Chairman.
Make sure it's recording. Okay, there is a motion for Paul Merton to be the chairman of the governance board for this calendar year. All in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries.
Mr. Chairman, I'll make a motion that we nominate Dennis Bush for vice chairman.
You are quick.
I'll second that.
I have a motion and a second from Cecil and Neil to nominate Dennis Bush as the vice chairman. Are there any other nominations? Hearing none, I'll call the vote. All in favor signify by saying aye.
Aye.
Opposed, nay. And motion carries as well. Congratulations. Okay. The minutes of the previous meeting were out in electronic form, and we also have them. I think there was a copy there you could have picked up. Does anybody see anything that need to correct to the minutes? Or,
I'll move that we approve the minutes of the December 27th meeting as presented.
I'll second.
okay, thank you. I have, and then just for Louise's, when we do motions, could I just have you give your name, who made the motion, and the seconds, just to make sure
I moved.
Louise gets them. Okay, and seconded by Dennis.
Yeah.
Thank you. Okay, any other questions or comments on the minutes? Hearing none, I'll call the vote. All in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. Next up, approval of the agenda.
I'll make a motion that we approve the agenda
Okay,
as written. No amendments?
all right.
I'll second.
I have a motion from Cecil and a second from Creston to, for the approval of the agenda. Any other questions or comments? Hearing none, I'll call the vote. All in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. Comments from the public. We do add this to, we have this on our agenda every month or every meeting. If there's anybody that would like to address anything that's not on the agenda, we would ask you to do that now. Okay, hearing none, we'll move on. Number 8, under unfinished business. A, the monthly financial report.
Okay, refer to this sheet that's behind your minutes. The total region in county balance, beginning cash balance as of December 1st, 2018 was $3,978,839.59. Total revenues for the region and counties was $70,544.14. The expenditure amount that I sent out in your the email with the agenda, the formula was not correct in that, so I've given you the revised correct copy for the handout, and the total expenditures were $159,643.73, and then ending cash balance as of 12/31/18 is $3,894,543.07.
Okay, and do we usually take action on that, or?
No, you wouldn't need to unless there's any questions.
Does anybody have any questions for Dawn on this financial report? Okay, we'll move on then. Thank you. Next up, Plains Area Mental Health Center, the FY20 budget request, which was revised, and also the mobile crisis proposal. Kim, are you presenting on that?
Sure.
Okay.
Okay, so we're presenting a little bit of a revised funding request. And as you can see on the top, we've added a request for $60,000 additional emergency funds. And this would allow us to provide that after-hours emergency service telehealth in the hospitals and jails. Now, I know currently the region is utilizing ITP. The deflection rate has been somewhat in discussion. So we're proposing to do basically the same thing, only using our therapist. So with the therapist, they're local, most of the clients are going to be our clients, we're going to know a lot of them. We hope that the deflection rate would be better, and we can provide, we are now contracting with Zoom as our telehealth provider, and we can pretty much do the telehealth from anywhere. So that's the additional cost to the emergency departments.
So with your telehealth,
Pardon?
coming from a hospital standpoint, your telehealth, where they have the individuals that are calling the facilities looking for bed placement?
Yes, we would then defer to our Turning Point staff, and they would be the bed locator if somebody indeed did need that hospitalization. They would do that type work.
And you're talking after hours, so during the day.
During the day, it's just a call to claim. Because what we currently have is open access, so anybody can just walk in and be served, or all of the emergencies are handled as they come in. So we already do that during the day. So this would just be an extension to the after hours, but it would be that face-to-face with the client via telephone.
With a counselor, not a psychiatrist, correct?
Yes.
Kim, I'm brand new to this, obviously. Can you explain a little bit about the deflection rate, what that means?
Deflection rate, that's talking about people that go inpatient into hospitalization,
Okay.
and on a committal basis a lot of times, and that's where the region picks up the tab. And so there's been not the expected deflection rate with ITP currently, and nothing against ITP, but their psychiatrists are coming from all across the country. It's telehealth, and I think they do a good service. But I think what we're proposing is using our local clinicians. So we understand the clientele. We have frequent flyers. A lot of them are clients that we already serve, and by not being able to prescribe those medications, and I know some of the jails are a little bit upset because their budgets have skyrocketed because the psychiatrists are just automatically prescribing medication. So, and we already have contracts with quite a few jails. So during the day, we already go into the jails. So,
Okay.
and we do have access to our prescriber staff, our psychiatric staff if needed.
Thank you.
Kim, let's talk a little bit about the conversion, of course, from ITT or whatever it is to planes. The hospitals, jails been trained to call them and that type of thing. Could you explain a little bit how that happens?
Well, it would have to be, there would be some training, buy-in. Some hospitals are used to ITP. Some of the docs like that doctor to doctor. So we would have to work through that, and I think it would take the region staff as well to talk about the reasons behind the utilization of ITP versus Plains area, if you so choose to move in that direction. We would have, Melissa would be a huge part of training, working with the hospital, the jails if necessary. It would just be, the transition would be very easy. There would be very little difference. It's just dialing, calling, or clicking on a different number.
Don, what was our cost with ITP, and what's our contractual agreement with them as far as when if we
Hold on just a
decide to
second.
change, how long we lock into them, I guess was my question.
We have a yearly contract. That question came up, I think, at our September meeting, I thought it was perpetual, but it's not. We can give termination notice. I think it's 90 days termination notice. And as far as the cost, let me look at our September minutes. I'm recalling that off the top of my head. I know we contracted for an amount up to $175,000. But as far as actual expenditures through October of 17 through September, it was it's low here. My computer's frozen on me. It was around, if I'm recalling correctly, it was around 75,000 that we had expended for that period. But they bill us, oh, here we go. They bill us on a fee-for-service basis.
Back to you, Kim. If we say, yeah, go ahead, what's your lead time to get this up and running?
Let me get that into the minutes.
Very little. We already have our on-call in place. It's just a matter of going around to the hospitals, you know, that little bit of training, some marketing, and, yeah.
I have a what-if question, and we realize now that the deflection rate is not good with ITP. What if yours is about the same?
Well, we also, we have a stake in it because we have the crisis home. So our hope is, you know, referrals to Turning Point and Siouxland Assessment Center. I think people not understanding exactly what the crisis homes do
Yeah.
is an issue. So internally, we all understand what they can do. So we're hoping that the referral rates to the crisis homes would increase as well.
There's a pretty good deflection rate in Plymouth County right now with Floyd Valley. Floyd Valley utilizes Plains Area's after-hours emergency contact every weekend, probably 4 to 5 times. I get the sheets from the therapist, and I would say probably at least 50% or more are deflected by talking to a therapist. And Floyd Valley they utilize that throughout the weekday too.
Yeah, Floyd Valley and Lamar's, we probably do 10 to 12 emergency calls from them a week. So we've been doing that for quite a few years, and they're begging for that face-to-face. So if we can do telehealth, and we will plan to do it in Plymouth County as well. But
Kim, I got a question. Do you have suitable manpower to take on this additional service?
yes, our on-call service is already in place. We've been doing on-call for 20-plus years, I don't know, longer than that, 30 years, I don't know. This is just adding that telehealth piece. So the only difference is, they won't be just doing it over a call. They might have to get up and comb their hair and throw a Plains Area shirt on instead of sitting in their pajamas, but that is the only difference.
Generally, and maybe this has changed, but I thought one of the advantages to ITP was they could make a physician-to-physician referral. Like
Yeah,
when you
that-
have somebody you want to hospitalize, the receiving hospital needs to hear from the physician.
Right, and it would have to be attending at the emergency room, which is what Floyd Valley does, other hospitals already do.
So in terms of actually finding those beds, we had trouble even getting a hospital to tell us they had a bed if you weren't the doctor calling. Is that doable?
We have our prescriber backups, so if we needed to call them, we will probably create a on-call schedule for them. They already do that for us. It's just more formal.
Is that a NP or physician, a prescriber backup?
We have 2 NPs, 2 PAs, and Dr. Dean, who is our psychiatrist. And we're looking at hiring another.
The counselor piece is what I see from the hospital perspective. Our ER physicians want to talk to an NP, PA, or physician. from the ER perspective?
From a liability standpoint on the hospital too, if my ER provider is turning away the patients or telling the patient to go to a crisis home versus inpatient services, and they have another provider agreeing with them, then they're not liable if that transaction goes south. But if they have a counselor on that's recommending that, then they're still liable.
And that is not our experience in other hospitals. So, you know, Floyd Valley strictly uses our therapist, and they go by those recommendations. And if need be, if wherever we're sending them, if they have to be hospitalized, that we get one of our prescribers to make that call to that ER doc or to that placement. So there's probably some more discussion maybe should be had with hospitals and their comfort level and work through some of those details. But
The aspect that I like about it is the continuity of care that Plains area is going to have in terms of the amount of patients that are probably they end up at the ER and they're patients of Plains area. And so I think it's just that from that standpoint, I think it's going to create a stronger system in terms of serving the individual. I understand the concern, the doc-to-doc referral, but if there would be some way to, I don't know, those are details we'll have to work out going forward, Kim, but if there would be a way to contract for the service, you know, with Plains area, I don't know, I'm just kind of talking out loud as far as would we be able to contract, provide it through Plains area, and then if there was someone who actually needed it, if it was a case where a doctor needed to assess the individual, then we have that available, even if it's through Plains.
Do you guys do substance abuse too then?
yep, we are IDPH licensed.
Dawn, I would add, you know, they're not always gonna be Plains clients. You know, as counseling services, we cover lots of counties. We you know, we're assigned to Sac and Calhoun.
Sure.
But we see people in Carroll and BB. So, you know, how many would be one agency versus the other? You know,
But then, as far as that goes, the care would be coordinated locally. Be that if it's Plains area, it's the one that, you know, they do the telepsych and refer the follow-up back to you as counseling services. I just think that would probably improve. You can keep going, Kim, with your budget request. I just got a lot of questions.
Okay, so as you can see, our C&E, we did drop down. We're working down towards getting down to that $50,000 minimum. And previously, or during this current year, we do subcontract with counseling services. So the $18,900 is what is going to counseling services. So we lobbed that off. So that's a decision between Dawn and counseling services for that amount. The clubhouse, the drop-in centers, we are asking for a $5,000 increase. The school-based services, we're only asking for the $20,000 to be reinstated. The reason for that, we've had a lot of requests, but it's midway through the school year, and currently we need to assess our capacity in order to meet all those requests. So I'm not going to ask for funds if we don't have a therapist to meet the capacity. We have had 4 requests, informal requests. We're kind of holding them off until the next school year to maybe have a formal agreement and assess their needs. We just haven't had the time to do that. Crisis and mobile response, that stays pretty much the same. In talking with Dawn, though, we did reduce the projected amount that we may receive or should receive from Medicaid, just because Dawn needs to capture that and encumber that in the budget just in case we don't meet that expectation. So, our goal is still to meet that roughly 4 a day that we're able to bill for. But just in case, Dawn needs to have it in the budget. The next one is med management. We are asking for a significant increase in that. I know last year we did fee for service, and then we capped, and it was moved up to 80 grand, but our actual expenditures are around 160,000. And our med management service is always in the red. Probably always will be to some extent. Psychiatrists, nurse practitioners, PAs are all extremely expensive. And we have a huge shortage nationally, but in Iowa, especially northwest Iowa, we pretty much have to pay what they're asking. So we do a lot of med management. We have another nurse practitioner coming on in February or March, so that our med management costs will increase, and we just really need to kind of bring that program more out of the red, hopefully into the black.
Is this 162, 450 then? Is it just going to be strictly the fee for service? What it is, and this is the number you picked out, or is this going to be a cap? Again, as we've been capping before.
We're fine with this year with, if you want to cap it at that, and we bill fee for service up to that amount.
Can I ask one more question on Nutella? Like, you do adolescents too?
Yes.
And with the question that you had, Neil, regarding the cost, I did find the total expenditures from October 17 through September, and it was roughly $57,000 between the jails and the ERs.
So the cost is actually about the same or a little bit less, but the collection rate we're not happy with.
Right.
Okay.
So with the, I'm just going to break down what the impact would be for us with the increase to the telepsych for the emergency services of $60,000 minus the $18,918 for consultation and education, adding in the $20,000 for school-based services, and then the $82,450 for med management. It's $143,352 in an increase. And then, as Kim stated, the $541,000 in MCO reimbursements. We have to reconcile with Plains area per our contract for actual. So we felt that was too. We wanted to be a little more conservative as far as what we may have to reconcile with them, and with our budget, spending down to that low threshold, we need to have some kind of safety net in there to be able to cover those costs at the end of the year.
Where are we funding the school-based program when Rolling Hills is responsible for adults? I guess that's a question I'm going to ask.
The reason that the request is in here is because of the decisions that were made on the school-based funding for Woodbury County at the last meeting.
That, I thought, was in, I'm asking this question so I can get corrected if I misunderstood, but wasn't that approved because we wanted to keep it afloat in case we got school-based mental health, and this would be rather starting up something new?
Well, they're already doing the service, but what they are providing within the school districts here in Denison and Storm Lake, and I asked Kim a similar question when we met last week, is if you're already covering this cost, why would we as a region contribute to this? And she stated that it doesn't cover the full cost of what they are providing within the schools currently. So that's why they're asking for the reinstatement.
What schools would you be covering?
Well, right now, we have a full-time therapist in Storm Lake schools, and now we have full-time in Crawford, all of Crawford schools. And we have, part-time intermittent therapists that go to, 10 other school districts. So when we break it down, and right now Crawford is what we get from DCAT and the school system. It does not fully cover the cost of that position. We do bill in other school systems, and so we're working towards billing in order to sustain the program. So the $20,000 just basically covers the cost that we're currently incurring.
We started that, Neil, when we used to have the Midwest Iowa health, mental health in Denison. We funded it. We started that program at the Denison School, and we were partners. And it's been pretty successful. And I think we get quite a lot of bang for the buck. For that $20,000 doesn't all come to Denison. Some goes to Storm Lake. So I mean, for the share that's coming to Denison, I think it's beneficial. And I said that was a carryover from our previous mental institute, and that's where it started, and that's how it's continued.
Well, we have it in the Carroll County schools too. It's all funded under DCAT, but I think the person is working under a person who has a license. They aren't the person doing it actually isn't fully licensed, is how I understand it.
Right, and that's what we have in Denison as well. So until that person is fully licensed, she can't bill.
Yeah.
So hopefully by April, she will be fully licensed and we can start billing. But for now, we're actually losing money on the Crawford County position.
Okay.
Are the schools budgeting for that then?
Storm Lake and Denison do.
They do.
And other schools, and that's a part of the delay on the other requests. They need to explore, they're right in the budget times too, to see what monies they can come up with maybe to help support school-based therapy in their schools, and for us to see what capacity we have and get more therapists on board. You guys have any other questions for me?
Okay. No other questions?
I just want to ask Don if we would decide to go with Plains area as opposed to ITP. As far as transitioning, they're asking for the money up front, or at this time. Would we be able to start this on July 1st and end that on July 1st and have it compatible in that as far as the transition is concerned?
Potentially, but I do think we need to have further conversations with our providers and with Plains area as far as what their needs are before we would make a decision to completely terminate the contract. And we've got some time to do that.
So we potentially could have both in place after
For
July 1.
various reasons.
Yeah.
Mm-hmm.
We wouldn't totally cut it off.
Yeah, I didn't want there to be a large overlap, and I could see where it caused some problems with the hospitals and jails handle.
Who do we call?
Yeah. And I can see it not having an overlap, if it all gets cut off on one day, just say, oh, wait a minute, we have, Plains is going to need some time to train these people to do the transition and that type of thing. So I don't have an answer for it, just a concern of mine.
I do feel better about maybe having our clients deal with real people rather than a TV screen, even if they're in a Plains area shirt with messed up hair as opposed to a figure on a TV screen. I think that would be an improvement over what we're presently offering.
Well,
We
it'd
still
still be
have-
telehealth.
Telehealth,
That's what we're
you're
offering.
still gonna use telehealth, which is a different,
Yeah.
different version.
It's
of ITP.
confusing because we also are doing the mobile crisis.
Well, that's what I thought. Okay.
So the mobile crisis that's where law enforcement, we're only going to start with law enforcement calls. So law enforcement calls, the Turning Point or whatever number we give them. Then we dispatch a mobile response staff. They will go out to the scene. So that will be a face-to-face. But we're using bachelor and paraprofessional level to do that service. So the on-call service is with licensed professionals. So that's the difference.
But at least they'll be Iowa-based as opposed to our ITT. They could have been in Florida or Arizona or wherever.
Yeah, it's all of our therapists take a week of on-call. So they're on a rotation.
I think the knowledge of the local areas and the services would be important to have, I think.
I agree.
I don't think, and the thing just crossed my mind of a conflict of interest with them having also the crisis home and them, sending people that direction versus the person in Florida who doesn't know that the crisis home is there. I can see a conflict of interest there, but I think there's more of advantage of knowing the local services versus steering people to another entity that you also operate.
But that's one of the reasons we wanted ITP to deflect some of that usage there that hasn't been
Yeah, and they didn't do it.
happening. I mean, it does help us utilize the service. My concern is still with the hospitals, if they're comfortable with being able to get the folks to the right, still being able to have them admitted, or, again, could you just say that again for us, what's your concern?
Well, I think our concern is the same, is that a provider in our ER needs to talk to a provider for that liability purpose. So a counselor level or a therapist level is not, there's still a liability for our provider if that patient is not admitted. And that's the concern our providers have.
From the hospital standpoint, for the deflection, I can say that we as a hospital here at Loring probably take some of that responsibility, because I'm not sure when our nurses call, if they're educating the ITP services, that we have those services available here locally. And so we'll probably change some processes internally with the hospital so that we let them know that.
Well, I think the same we don't have law enforcement in the room, but I think we'd have that same thing there. I mean, with law enforcement, it eventually gets into the judicial law, we're not, I guess, court ordered, but it just always seems like let's just push this all to the hospitals and everything else, and we're just trying to avoid a lot of that, where we don't have to, that expense, but, okay. Anybody else have any questions or comments on this piece before we move on? Okay. Next up, Carla, Counseling Services.
Carla and I met the other day to discuss their contract, as they're going to contract separately from Plains Area Mental Health Center next year. Carla had indicated that because they have been designated for Sac and Calhoun counties since the region took effect, and even before that, they do provide some emergency. Do you have a copy? That they are providing some emergencies, not a lot during the year, but they do cover some of those as well as some consultation and education. They are looking for some funds through the region to be able to continue to do that versus having to redirect a person that has contacted their agency for services. They want to have the ability to do that versus, referring them on. So with that, I'm going to turn it over to you, Carla, and you can explain what you are asking for.
Yeah, I mean, so counseling services we're a private practice, but we are accredited by the state to be a mental health provider. And before regionalization, we were the designated provider in Sac County. And then when we regionalized, we agreed to kind of take on responsibility for Calhoun County as well. So we have mental health services in both counties. We have offices in Carroll County as well, 2 of them. We draw clients from almost from all over the region. Of course, we're not seeing people from Cherokee so much, but people go to the office that they're either closest to or most comfortable with, or what makes the most sense for them. They don't necessarily go within their county. So we have been providing like daytime emergency services, mental health wise. That's been kind of our arrangement with Plains, is that we would have Sac County and Calhoun County. A lot of that's availability. If somebody calls, we're available. We pass a cell phone amongst our clinicians so that if we always know who's available, and somebody calls, they get a person. The after hours on call has been then, kind of through the Plains system that that they've contracted with Foundation 2. So generally, we've kind of run those funds, from Plains to us. We're just wanting to separate, to have our own contract, to negotiate those things that make the most sense for the counties we're covering. The figures that are there, we're looking at a reduction for 2019. Plains has had an agreement with the region to reduce the amount they've asked for C&E over the years. So we're reducing our ask for C&E for next year. And we've also are reducing our emergency services a little bit, knowing that, the region's got lots of projects in the fire coming up. And if our emergency services increase a lot in the next year, we may be back to renegotiate that for 2020, but this is where we're looking at for 2019.
Okay, so right now, I want to get this straight for us, is a collaboration with you and Plains area. And the C&E has been being reduced each year by $25,000 to get down to. So would that still be part of our plan to get that down to 50,000, combined, or is it going to be back, we're going to have 13 here and back to until capped at 50,000?
No.
So is that going to be part of the 50, or am I missing
No, I see what you're saying.
all that?
No, Plains area, they're going to look at reducing their amount, 25,000 every year, until we get to 50,000 and reassess. And then Counseling Services is looking at their portion of what they would have received for that, and that's why they are reducing it as well. So they're reducing their C&E by roughly $9,000.
So are you asking, Paul, that once the reductions are made?
Right, when
is
we
that
get to that
50
cap, is that 50,000?
shared between
Right,
Plains and counseling services?
yes.
Not sure, Dawn, how you want to look at that?
No, I'm not looking at it that way because they have a higher amount than what you're gonna be receiving, so I think we need to look at Plains Area's contract separately, that they're gonna be reducing down. We get to 50,000 with Plains Area and then we reassess.
Okay,
And so you gotta keep in mind too, with the 18,918 that Plains Area pulled out of their contract, it's still listed in the budget as the full amount, so it's really only an increase to this budget year of the difference between 43 and 18,000.
25.
Yeah.
okay. So it is that 25,000 reduction, okay. Okay, very good. Does anybody else have any questions for Carla? Thank you very much. Siouxland, next up is Siouxland Mental Health Center FY20 budget request has also been revised. We should have a copy of that. And then we don't have anybody here from Siouxland Mental
No,
Health
I'm
today.
presenting on their behalf because they had to be in Des Moines for a meeting today.
Okay.
So I met with Sheila Martin and Joel Peterson last Wednesday regarding their budget requests. So we had a really productive meeting in terms of looking at what their needs are in comparison to what we actually provide in terms of block grant funding in Rolling Hills. And if you probably don't have your copy from last time, which is the budget request that they had with an increase of $363,000 for next year's budget. What we did is look at all of the requests that are broken down in the projection you're looking at, and since Rolling Hills does not pay or block grant for fee-for-service for outpatient mental health services or medication assistance, that $160,000 that you see about 3/4 of the way down on this request, we reallocated those figures into other areas of the budget. The intakes for new patient assistance, the bilingual assistance as well, that's not something that we fund currently. And so we took those items, lines B through E, in addition to the mental health services and the medication assistance, and reallocated it into other areas that they felt were more important and, pertinent to their needs. So the nurse care management was reduced to $325,000. We increased their same-day crisis services to $207,000. And then you can see that we decreased the other, C through E, for a total of $532,000, which is less than their request of the $700,263. And then below that line, their Project Compass request, we worked that figure in with the reallocation as well as the increase. It shows here that they're asking on the total cost for Friendship House of $192,637, and we provided the $214,131. But if you go back to this budget projection that they presented at last month's meeting, they were actually asking for an increase there of $214,131. So that's where that amount was included. And then with the assessment center, I do have this on the agenda to discuss under new business for an update on that. But this figure was reduced to $585,400 for Rolling Hills, and I'll explain that when we get to that bullet point in our agenda. So in total, the request is for $1,510,350, and in comparison with their FY19 current budget with Sioux Rivers, it's only an increase of $43,000, I believe. Figure somewhere. Yeah, it's $43,350 is the increase for next year versus $363,000. So I think came to a good understanding of what we can do in Rolling Hills and in comparison to what we provide with Plains Area Mental Health Center and what their needs are, and we both were very satisfied with the outcome of that meeting. And Sheila, she was comfortable enough with this adjustment that she didn't feel they need to be here today and wanted me to just present it on their behalf.
What is our coverage area on these services?
The what?
Coverage area?
As far as
Who are they
people
gonna,
served?
who do they take care of, like at the Friendship House, peer support, et cetera, et cetera?
We zeroed out the peer support, so that is not something the region's going to be funding. They can bill that out to Medicaid. But as far as the Friendship House, the majority of the people that are going to be served are Sioux City residents.
Mhm.
And the Friendship House is their drop-in center, similar to what we have in Carroll with Plains Area and Denison in Crawford County.
Clubhouse.
Yes, exactly. I couldn't tell you how many people they serve. Paul, do you recall that from when you toured? But I know they have a,
Well, it was, I think
they are
there
at
was
capacity
40 some, I believe,
that day.
on a full day. I just
Yeah.
on that one day, yeah, that we were, total, I don't remember now. It's a busy place
It is.
and needs some work, which we'll get into here in a little bit.
Questions about it?
I think we worked hard with them, with Sheila and them, getting from the original point, their original asking, we kind of got that way whittled down, and I think Dawn's done a good job of getting that from where we were first looking at, so it's, I appreciate the work.
At the end of the meeting, I think that we, on both sides, felt it was a win-win situation for both Sioux Mental Health Center and Rolling Hills. Jeremy, did you comment?
And just to reiterate and confirm, Norm, this stays within the 3363
Correct.
expectation of Woodbury County. Thank you.
Okay, any other questions on the Siouxland Mental Health Center revised request? Okay, hearing none, then we'll move on. So the fiscal year 20 budget adjustments, and where we, do we want to put any new business ahead of that, or do we want to,
Which items are you thinking?
well, is it going to affect these other requests? Is that going to be, I mean, is this where we actually want to approve the budget yet or not? I mean, are we that far?
If you want to, we've already approved the agenda.
Yeah.
Do you want to discuss the budget adjustments and come back and take action on it
That's-
after we get through the
That's what
business?
I'd like to do. I guess I should have probably looked that over a little better, but
Okay.
Under the new business, I'm sorry, I didn't see anything on Howard.
I have it, and you don't need it.
Oh,
And I'll
okay.
explain why. I left it on
Okay.
the agenda just for a brief explanation
Okay,
as
thank
to
you.
that request. Do you want me to discuss the budget adjustments or just move on to new business? And is that what we're doing?
Would it be easier to do it that way instead of,
That's fine.
okay, I think I would rather do that.
All right, so the Howard Center had submitted a proposal. I believe I emailed it to you, but I just didn't make hard copies of it, just for the simple fact that now they have asked to strike this on the agenda, or at least pull their request, because they were asking for some training costs that providers across the region cannot recoup within their rates. And I shared with Pat my concern that in doing that it could be a pretty high price tag for the region if we start this with one provider. Then all the providers that have the similar needs will follow suit. And so, yes, it could be pretty costly. When we were discussing this, I said that the region can invest in training for our providers. We've done it in the past. If you recall, back when the region first started, we'd have annual trainings for different topics that would benefit our providers and strengthen their agencies. And so I see this as something very similar. If we're going to do anything like this in terms of training, I would rather have it benefit all of our providers versus one. And she understood that, and she said, I don't think that, you even need to bring this. She honestly didn't think I was gonna have it on the agenda. But, so she is not asking at this point for $6,000 from the region. She just wants, at some point, if the providers identify a need that the region can help with in terms of training, that we would be open to doing that. And I certainly am, as long as we can fit it within our constricted budget right now, so.
Okay, thank you.
Do you have any plans for providing or starting training for, I guess this is for supported employment staff training is what it was. Do you have any plans for doing that, or do you think you might do it, or?
We talked about their needs, and because they serve primarily ID population,
Yeah.
when they do serve a person with mental health issues, I think their staff, they just want some training in the areas of mental health so that their staff feel confident that they're doing the best service possible for those individuals. And I, had mentioned to her that we got consultation education through 2 providers we're already funding, so to reach out to what we have locally. But as far as the certifications that the actual job coaches need, I think that we have some options we could look at, maybe, contacting the Coalition for Supported Employment out of Des Moines and seeing what they could offer. So those are some ideas that we had talked about.
Okay, thank you. Next up is the Siouxland Mental Health Center capital project request there. Now, we do have a 3-page or 2-page. Again, we don't have anybody here to.
I can talk it through, and then Jeremy, feel free to, jump in whenever you see the need. Just to give you a little bit of history there, the way I understand it is that Siouxland Mental Health Center had requested for the Friendship House, which the building does need some repairs. They wanted a building project, and they had requested that from Sioux Rivers, I believe, in 2017, early 2017. It was approved by the Sioux Rivers Board, and then went, correct?
Correct.
It was approved. And then the Sioux Rivers Board voted to rescind the approval for that at a later date when they found out that Woodbury County was going to be making application to Rolling Hills. So they did not get their building project, and they have decided to make a request to our board to fund some of the repairs that they need to the existing building that they're in. They are looking at contracting with the Dunes Contracting out of North Sioux City and I don't really know the details other than what's in this proposal. Expansion of the front door, moving the stairs, and fixing the physical structure because of existing water damage that they have, and then some cosmetic updates, which I think Paul and Scott could vouch for, that are probably needed. And they are looking at providing the repairs within the $100,000 budget. So I don't think we need to take action on this today, but I can assure you that the way we have set up the Woodbury budget, that there would be some ability to cover some of the costs or all of it within that Woodbury 3363 per capita.
And this would all happen after July 1st?
I believe so, yes. Put a deadline in there.
Well, there was and I don't know how this meshes. Maybe you guys can help me out with that. There was a request at I don't know if it was the last or the second to last
It was December board meeting at Sioux Rivers.
Sioux Rivers, about a $9,000 to fix some stuff in the kitchen. I think I did see some of that in here, but so are they gonna still wanna do that, kind of a Band-Aid thing till they do the bigger remodel, do you know, or is that?
Yeah, that was my understanding, is that was to mitigate the problem that was going on at that time, almost akin to an emergency repair.
Okay, so then that 9,000 isn't a part of this.
Right.
This would be, okay.
And I can confirm that, but I believe that was separate.
Okay, thank you. Yeah, I think, well, you know that area too, but I think a lot of that water issue, well, I know some of it's internal plumbing, but the outside water, I think if they could get something done with their neighbor, would be, dumps all the water on top of them, help that basement piece, but.
So you're,
that-
oh,
No,
I'm
go ahead,
sorry.
I'm sorry, go
You're
ahead.
proposing that this money would come out of Woodbury's?
Correct.
I guess if that's the case, and is this something that if they wanted to do the repairs earlier than July 1st, as long as Woodbury's paying for it anyway? Is there a way, apparently these are needed repairs. Could they be started earlier if we figure out a way to direct the money, being it's coming from Woodbury anyway?
It can't come from us until after July 1st because they are with Sioux Rivers. And I didn't want to go down the path of having to let Sioux Rivers pay it and we reimburse us. I just don't
Okay.
want to go down that path. I think best case scenario is if they can cash flow some of their repairs, knowing that if this is approved by our board, the money would be forthcoming.
So you're saying, in other words, Dawn, if I'm understanding you correctly, that Siouxland Mental Health could go ahead and contract for this?
If it's
Put
approved.
the cash flow out there in order to be able to cover expenses with the understanding that
The
July's-
check's in the mail.
Right, right.
Yeah.
And that it would be subject to the availability of funds from Woodbury County covering it.
Yes.
Just, and if you don't know, that's fine, but going back, the original thing was to actually build a new building where the Friendship House is, right? Was it build a new one, or were you were they looking at
There were several
purchasing?
different iterations of what was proposed. It was approximately $1 million originally.
Okay.
And then it was the requirement was to bring in an architect and sort of value engineer down to about $675,000. And then there was another proposal at one point to buy the former blood bank building at a cost of about $343,000, make some modifications. But by that time, the train had already left the tracks as far as, going to this region, and so then it was the rescinding of that funding and that portion of the motion for Woodbury.
Okay. But at that point, you were looking at, through Sioux Rivers, a $300 and some thousand
Yeah,
project
at
is-
least as far as the purchase of that
Yeah.
building, and then any modifications to make it not a blood bank, but a,
Yeah, and I understand, and we kind of drove by that building just from the outside. And again, as Scott and I toured the Friendship House, it needs work. We understand that. It's just that the space, I imagine the other building would have had a larger space.
yeah,
Capacity
it would have
to
been
it, so-
ideal, but by the time all the machinations worked out, it was sold,
Yeah.
and so it's.
Well, even if that's something that moves forward, you got a building with 100,000 repairs. It's going to help resell down the line too. But okay.
Is this a issue where maybe there's been some informal commitments made through this? We haven't been a part of this whole transition with what went on in Woodbury County. So are they expecting maybe something that maybe, how we sometimes do, well, we'll try to help you, yada, yada, yada?
Yeah, I would say generally speaking that I've said
I mean,
Woodbury
if you
County's
got skin in the
position
game-
isn't that we're going to guarantee $1 million new building or anything like that, but we will look to address some of those needs. It may not be $343,000 or $1 million, but we do believe that it's appropriate, and to the extent that we can cover those costs during that first year, that may be. Yeah.
Well, that remodel too on this proposal they gave us, I think would address a lot of that emergency stuff they have going on right now that we didn't even see. I think that popped up even after we knew there was an issue with the sink, the way that they utilize and all that. We won't go through all that, but.
And I would say one last thing, having that location, I think is really critical to those who utilize it versus a brand new building, just, the familiarity, the location downtown, bus routes and so on, so I know they'd be appreciative.
Because I think the other the blood bank building isn't that far away, which maybe not as, but if you build a new facility,
Yeah, they were talking
Way
way up
up
by
at
the
the
crisis
assessment
center, which
center.
is really out of the location
Yeah.
of where those folks.
that made sense when we looked at that. Okay. Okay, any more on the, I'm assuming that B, we're just talking the Friendship House on that B, right?
Yes.
Okay. Now we have C, the Siouxland Mental Health Center, the Crisis Stabilization and Assessment Center update.
Yeah, so December 28th, Jeremy, Dennis, Paul, and I met with 3 members of Sioux Rivers, their board members, and I think one was just a county supervisor. Can't recall the last names of them all. And then Shane regarding the disposition of the crisis center. I think throughout that discussion, it was obvious that there is a need for the service, coupled with the fact that they own the building. How we were going to take care of that. We had a lot of discussion and finally arrived at maybe a joint partnership for the first year as far as funding that facility so that it doesn't terminate. After a couple hours of discussion, we decided to negotiate that Rolling Hills would fund 75% of the asking of $780,000, and then Sioux Rivers fund the 25%. We recessed for a while and discussed that. They discussed it on their end, and when we reconvened, they were in agreement at that point with looking at the 75-25% share. And so that service would be able to continue next year and give us a little more time versus 6 months to decide how that facility could be best utilized. And then looking at the needs of our whole region with the 8 counties joined together on July 1st and meeting the needs of our crisis services going forward, because we can all agree that there is no need for 2 facilities that provide crisis services because of our low census and numbers in both facilities. So I think that's just gonna buy us some time to get us through that 1 year. They were agreeable to the 25% at that level. Now, next Tuesday, the 22nd, or would that be the following week? What's today? Yeah, next Tuesday. Paul and I are going to go up to the Sioux Rivers board meeting because that is on their agenda to discuss that. And so we're going to be there for any questions that they might have and see what the outcome of that meeting is as to whether the full board would agree to doing the 75-25% split. So if they don't agree to that, then we're back on the $780,000 request. But I've talked to Shane a couple of times. Even just yesterday, we had a conference call for the CEO collaborative of our area, and we talked about that again and jointly funding that, and I'm not getting any pushback on it at this point. So go ahead, Jeremy.
What is the disposition of who would be contracting? Because that was an issue at the time, whether or not it would be Sioux Rivers contracting with Siouxland Mental Health, and Siouxland Mental Health initially sharing that wasn't necessarily what they would like to be doing. I mean, that's one of the reasons that we're here, versus Rolling Hills and the fact that we're collectively 75%, what makes more sense. And so that was I don't know if there's any update, Dawn, that you've had from Shane on that, but it seemed like our initial position would be, it'd be better for Rolling Hills to be contracting, and I think their position was, well, we own the building.
That's 100% correct. When Sheila and Joel and Bev Zehner, who is the Siouxland Mental Health Center board president, met with Shane last Wednesday, he was adamant that Sioux Rivers will maintain that contract. And historically, counties and now regions contract with their host providers. So for Woodbury County to have the assessment center in Woodbury County would be host county, we're host region. I feel that we should hold the contract for, and we're paying the 75% vast majority of the cost of the service, but Shane was adamant that their board is going to hold that contract and that we will reimburse them. They will hold the contract, they're gonna make their payments to Siouxland Mental Health, and then we will reimburse Sioux Rivers. So that's another reason that Paul and I are going to be there on Tuesday. I would not expect to have any other provider outside of my region that I would hold a contract for a provider down in Southwest Iowa, MHDS, because I own a property. I wouldn't expect to have the contract for the service. There are two different things. It's the service and the building. So.
That could be a deal breaker.
At one point I thought maybe, but I think that we have come to an understanding with Siouxland Mental Health Center that I think that this is going to be workable on
Yeah.
both sides. But I do think that it's just going to hinge on the outcome of the meeting next week and what their board decides, because they own the building and they can be the property owner, but as far as contracting for the service, I'll maintain that it should be Rolling Hills contracting for the service. We pay the 75% and then Sioux Rivers reimburses us.
Yeah, there's a lot of
Or they
questions
can
there.
pay
Yeah.
directly, however they want to do
Yeah,
it.
I think it's still a piece of the puzzle. Still, Siouxland Mental Health, as Don said, if they're going to contract with
Would they
Sioux
prefer?
Rivers.
Yeah.
I can't speak for them or wouldn't know. So we'll
I was
have
just
that.
curious how Don feels about it, 'cause
We'll have that
Don Cass.
conversation. We've talked about that. That's kind of the biggest point we're looking at. And I'm sorry, I should have probably went back to the budget for this, but I just wanted folks to be aware of some of this money
Oh,
things
sure.
that looks in our budget. But so let's. Does anybody else have any questions
Well,
on
I
that?
have, if we're gonna contract with them, if we have difficulties in the future, does that make it easier for us to leave?
Well, we're not
Explain
going to
that
contract.
part.
We're not going to contract with Sioux Rivers. We're going to contract with Siouxland Mental Health, is my understanding.
but that's just a
But they're going to
one-year
have.
deal,
But
right?
so Siouxland Mental
One-year.
Health is going to have to be the one that contracts with Sioux Rivers.
We're going to have to do, because we will be either, the way we left the conversation is that they are going to hold the entire contract, the full 780, because they own the property. They're going to pay Siouxland Mental Health, and then we reimburse Sioux Rivers. So that implies to me that we would need a contract with Sioux Rivers to jointly fund the operation.
If, well, there's still the if, and I'll put it out there. Still with Siouxland Mental Health, if they don't, they're still, Sioux Rivers is still going to have to contract with Siouxland Mental Health. In my mind, if Siouxland Mental Health says we're not interested in contracting with Sioux Rivers, then where are we at that point? That's my question and my concern. Whether it'll get answered or how it'll get answered at that meeting, I don't know.
And that will be up to their board to decide
Right.
whether they.
We don't have any. We'll move on from there and see how that goes. So, but we're trying to get it again. Do the best we can with what we have for the transition year, or the transition till we all get everybody's all together on this.
But this is only a one-year deal anyway.
On your
Yeah,
contract,
yeah.
yes, to reassess our needs and the resources that we have between both.
But our 3/4 of the operation would be about 600,000, right? If we're gonna pay 75% of the,
Right, 585, 400.
yeah.
And we kind of came to that. It came out pretty close. We took the census of our region and the census of their region, and it works out to about. It's pretty close on that. We
What-
rounded up a little bit. It was 73% or something. But I think we rounded up just to make it a
Yeah.
easier split. But
What happens after the first year? We're talking about the first year. We haven't agreed to that yet, of course, but what happens after that?
As far as property ownership.
two assessments.
Services.
Well, the services, if Siouxland Mental Health Center agrees to contract with Sioux Rivers, then the service will continue. If they don't, then I know Shane, when I visited with him the other day, he mentioned RFB for that service because they own the building. I don't know of any other provider in the area that would be interested in doing that at this point, so.
But I think Sioux Rivers needs this just as much, because they could have an RFP, but if they don't have 75% of the funding, there's no way that they can afford that center. and it's like 60% of their entire budget. So, to me, I've always looked at it, and I know it's easier said than done, but a building's a building. It's the cost of service. It's really that, you know, we have other building stock around, and I understand that could be an upfront cost, but rather than be indebted forever if this thing does go south, you know, I think that's something to consider, rather than, oh, we have the building and that's held over everyone in perpetuity.
But you're right, so at that point, it's their bill, we walk away and we'll figure it out somewhere else, so.
But on the flip side, if a guy's gonna do the serious negotiating, we need to do it between now and July 1st. Because if we go 1 year, it makes it a lot more difficult to leave the second year, just because of how the world works.
I don't see the advantage for them necessarily, or disadvantage with rolling up, holding the contract and them having a reimbursement, as long as I think it's reiterated that it is their building property. Nobody's disputing that. But that's my perspective. I don't know if it's shared over on their side.
Yeah, that's a deal, that'll be between Sioux Rivers and Siouxland Mental Health if they're gonna have a joint contract with them. We don't have any discussion on that, so. But. Okay, any other discussion on that? If not, actually, let's just run back up to the fiscal year budget adjustments then, Dawn, if you wanna.
Well, last meeting, we had landed on a 2210 per capita. And then I caught a few days after that, that the $300,000 that Rolling Hills had designated for non-core had been withheld from that 2210. So I added that bit back in, and we ended up with a service expenditure amount of, let's see, we were at, yeah, it was for total at $3.6 million budget, which brought us to the 26 per capita, as I emailed you when I caught that. So with the budget adjustments that we're looking at for Plains Area Mental Health, there would be $100,000 that I would add in for the med management component if we decide to approve their request. And then for the conservative projection on the reimbursements from our MCOs, I added in $200,000 to that 3.6. And then one thing that we have not talked about is our fiscal agent fee that will be increasing. I increased that from $11,000 to $40,000 for the budget because after meeting with our Beatty County auditor, the cost advisory services group out of Des Moines that does all the county's indirect administrative expense, they, for just our 7 counties, the auditor's office, their projection in terms of cost for the claims that they process and all of that they do for the region financially was it came back at $40,000. So I added that in, and with those adjustments, our total budget would be $3,999,936. And then that brings us, in order to get close to that 30% threshold, our per capita target of 3075 would raise, provide to the region $2,928,323, plus our fiscal year 19 projected ending fund balance at $2,268,416 gives us a total revenue of $4,196,739. Minus our expenditures, and our ending fund balance comes out at $1,196,803 for 29%. Okay. Woodbury County, there are no changes here. I have their administrative costs at $320,642. Their service expenditures budgeted at $3,125,258 for a total of $3,445,900. With a 3363 per capita target. And then they're going to be contributing their contribution through levy and whatever excess fund balance they exit Sioux Rivers from. And total budget between all 8 counties for FY20 would be $7,445,836. Now, if the additional amount for counseling services is approved, I figured that out today. I think we go to a 31. instead of 3075. We can do it on a 31 or 3150. Hold on just a second. Yeah, with counseling services, the additional 20, if you don't want to move the target off of that 3075, that's fine. You could probably contain it within what we have budgeted. Otherwise, you could do a 31 and cover that cost because it's just the additional 25,000.
$31 even.
You could do 31.
Otherwise, if we don't, if we leave it at 3075, say we drop down 25,000 off of our ending fund balance.
Right.
Basically is what it do.
Right.
Okay, and I like seeing the sheet this way. I mean, it still shows us kind of a separate, the 7 counties where Woodbury with the other, the different levy rate there, and we're still living within what you folks are comfortable with. I believe not 3363. This is where the sticky part on in my mind is we're spending your money here now. We're voting on your money and but we want your input, which I think we've gotten.
And
over the
we're
last few
appreciative
meetings.
you've taken it along the way, so we appreciate that.
And I'll go back, Dawn. I know we talked, okay, so using the 3363 for the Woodbury side then, and that's why I wanted to jump down into some of that new business, especially this 100,000 out of the Friendship House. That would still be able to be covered under that. Is there also an increase in because I think on the fiscal agent fees,
I added the fiscal agent fee
so
into their
we're roughly 40,000 for our 7 counties and 40,000 for theirs. So I just want you all to be aware that we assumed basically we're doubling the region, so we're assuming out of the CASI report it's gonna
Now,
double
are we
that. So
going
that,
to process everything out of BV, then all the claims?
that's the
That
well,
hasn't been decided yet.
right. That'll still be part of our staffing, but that's the way we would.
I would think that'd make the most sense.
But we have to, yeah. Well, when we get through the budget stuff here, then we go into the staffing.
Mechanics.
Yep, and then where we are and how we're gonna run the logistics of all that, so.
I'm a little confused that on our 7 county, the target of 3075, that's not the actual, what we're going to ask each county to levy though, is it?
No.
No.
Okay.
I knew that would come up again.
Yeah.
No, that is confusing, and I understand that. Just think of your per capita is not your levy. Your per capita is what you are paying to the fiscal agent, and you could do that by your fund balance and your levy, which the spreadsheet that had all of the 7 counties listed in, plus the region that I demonstrated for you last meeting, I did not adjust any of those figures to
Okay.
higher per capita yet because I thought it would just muddy the waters and create more confusion until we decide what per capita you want to have for next fiscal year's budget. And then I'm going to readjust the spreadsheets and send it out. And plus that, I really need a decision on this today because I'm scheduled already Monday to meet with the Carroll Board. So I need to be able to show them what they need to levy with their fund balance that they're going to have at the end of this year to be able to provide that 30 per capita or 3075.
And you'll have that amount on Monday, right?
I will, if you make a decision for me today.
Are there any other questions on this? Are you all ready to, we've had the 6 budgets, we've had it all, we've kind of condensed it all, it's all been put down. These are the numbers where we kind of landed at as best we can. Does anybody have any issues? I guess as a little history lesson, I mean, last year, our 7 counties, the contribution was $24.
This year.
Or for the current year, so it is up from that. 2 years ago, we were at 3267, which is based off the low. I think it was BB counties was the lowest, and we built that up. So it is. It's still lower than And we're looking at, and that's up to you, if you want to do it the 31 or the 3075, I think we can live with it in either one of those. We just have to make that decision. Again, that's your contribution to the, based on per capita.
I know you don't have a crystal ball, Dawn, but in 2021, I guess I'm trying to get rid of the sawtooth effect on these levies. So you have any, I know that maybe whatever number you tell me would be strictly just a guess, but do you have kind of an educated idea what?
No.
Okay, well, you're.
I'll be honest, but I can tell you that I'm more comfortable with this per capita target at what we are versus the 24, because for the next budget year, we're not gonna have that reserve sitting there, and that's where you're gonna see the big upswing. So I think for this, for us with the 3075 is probably gonna be more palatable, because you're still gonna have, your levies are still gonna be relatively low, but that per capita isn't going to adjust as dramatically. And then at that point, it's just going to be, you're going to be levying for the full amount because you won't have any fund balance to contribute towards it. We can go up to the 4279. That just depends on Cecil, how many services we move forward with in fiscal year 21 and 22. Keep in mind that it's the fiscal year 20 budget that we have to be down to those 20 to 25%. And then for 21, when we're working on the fiscal year 22 budget, that's the year we have to allocate the property tax relief back. So for me to give you a number as far as where we would be, it'd be very difficult without knowing what our service investments are going to be. But we do have that ability to go up another $12.
And I'd like to put in there that also depends on the legislature doing nothing this year. And if you listen to the governor's state address, changing the limitation on their ending carryover balances, she asked the legislature to address that. She also asked the legislature to come up with a sustainable funding for the regions, and she asked the legislature to do something with children's mental health. Those were really caught as a proportion of her speech. That had the major part of her speech.
The reason I was asking that question, in a couple of years I won't be here, and I don't know about the rest of them, but for whoever fills this seat and these other seats, I guess 3 or 4 years out, those people might be held up to a light that they're spending money more rapidly than what we did, because we're gonna have, the trend line's gonna be going up, and I guess I just don't want to hold them to undue criticism of their spending habits on maybe something they have no control over. Because if we go to get into the $42 range, for instance, that's a pretty, on a county per county basis, that's a pretty significant increase right there.
It would take a lot of explanation and education on the part of those new supervisors to explain that as to why we would be where we are. But it has nothing to do on a local level. It's all legislatively mandated.
Well, with governor should get what she wants, having both houses. It's not like she's got
I've been hearing just in recent days that there's pretty good chance that cap is going to be lifted. And ISAC is doing a campaign. I don't know if you guys all received the email from ISAC yesterday on the videos that they're asking you to promote and send on regarding the limitation on mental health funding. Okay, I can forward that on to you. I thought you would have received it.
If they do take that cap off, are we gonna still zero out the county's fund balance?
Depends on when they make that decision, because if they do it in April, we have our budget set. If we have to zero out the county balances, I think it'll be okay. I think that we'll still be able to cash flow in and out for salaries and what we need.
I guess that I'm not terribly a fan of, I can see both sides of removing the cap, but I think the cap also does serve a purpose. And I think that,
They came, got it.
you know, it may push us to spend our money more wisely if we know that we got a fixed amount of money to deal with, as opposed to, well, we can add this, do this, and we're unlimited on what the levy can be.
That was the purpose of it. That was the purpose of it.
But supervisors still have to make the case to their constituents that they made the right decision, and if their constituents don't agree with it, you know, they'll just replace us, so. I mean, there is kind of a checks and balances there.
Yeah.
Okay, Vice Chair, take over. Paula had to take a call, so go ahead.
Oh, all right, well.
I guess at this point, I think you need to take action on per capita target contribution, where you want to be, so that I have the ability in the next couple of days to get budget numbers for the counties adjusted and out to you.
I'm being saved here.
Well, sorry about that.
Just ready to make a move. You got back just in time, Paul.
Okay, so where are we at with that? Do you want to take action today? And I guess the number I'd like to know is, do you want to leave it at the 3075, or do you want to adjust that to the 31?
I'd like to leave it the way it's written.
Okay.
I don't know how the rest of you feel.
I agree.
All right.
Fine with me.
I'm okay with that. Doesn't make a lot of
Okay.
difference, but I'd prefer your
So,
3075.
I guess on this then, do we, the motion that I asked for this, to decide this today, we'll just do it on our 7 counties, or are we,
I think you could do two.
a motion for the 7, then a motion, because our 2080 does allow us to have a different
Correct.
cap for a different per capita for an incoming
Mhm.
county. So, all right, let's do it that way then. Let's take I'd accept a motion.
Establishing the cap for the original
So-
7 counties.
Yep,
I'll make that motion.
and it's for 3075.
Yeah, 3075 as written.
Thank you.
I'll
second that.
I'll second.
Who seconded?
I got 2.
Okay.
Brent Wilhelm.
We'll get Brandon out.
There you go.
There you go. Okay. Any other discussion or questions on that? Talked it all through. Okay, hearing none, I'll call the question. All in favor signify by saying aye.
Aye.
Opposed, nay. That motion carries. And now to address the Woodbury County one. Again, I'll just ask we're okay. You guys are good at the 3363?
I'll move to assess Woodbury County 3363 per capita.
Okay.
I'll second.
Neil and Creston, thank you. Any other questions or comments? Hearing none, I'll call the vote. All in favor signify by saying aye.
Aye.
Opposed, nay. Motion carries. You have what you need to work with, right, Dawn?
Yes.
Okay. Well, that gets us down to D under new business. We had this January strategic planning meeting, the outcomes and recommendations. Dawn, were you or was Terry who were we gonna have present?
Second C in me.
Huh?
The second C.
The second C, yeah. I just made it a D. but-
Okay, just a brief update on this. I had contacted Terry Johnson late December to see if he would be interested in providing our facilitation, and he was willing to do that. He did a great job, as I anticipated that he would, facilitating discussion on what the unmet service needs are within our region, including Woodbury County, and prioritizing the crisis services that are in code that we need to have available by July of 2021. The attendance was just better than anticipated, and Woodbury County was very well represented. We actually had 2 of their deputies attend the meeting, and so we were able to get input from their providers as far as what they saw, as well as trying to tie that in with our 7 counties. So Louise took notes, and you have the minutes available to you from the meeting. We identified our top 3 priorities that we're going to work on in the next fiscal year, or starting now and into the next year. Number 1, mobile response, which is what Plains area will be providing for our region, and then we're going to look at some type of mobile response for Woodbury County. And Teresa and I talked to she got here today that we're hoping to set up a meeting with their Siouxland Paramedics, who does kind of a scaled down version of it. Siouxland Mental Health Center is also interested in being a partner in that, so we're going to get something set up here in the next month. The second priority for us is the Access Center, and that I think is going to be a struggle because we just had our CEO collaborative meeting yesterday, and I'm still the Lone Ranger and the one that believes that we should have a physical structure for access, not a virtual network of assessment at a hospital and triage. I don't see that as being any different than what we have, but maybe I'm just not completely understanding what the other CEOs want to pursue. And then the last was the intensive residential service homes. DHS is right now doing a survey as far as how many individuals within the regions could be identified as eligible for the service, because the criteria is pretty strict as far as who's eligible. And then the MCOs are also going to come up with their numbers. We have to have our numbers in by January 25th. I'm thinking we may have 1 or 2 people that could qualify for that intensive level of care. And then as far as other services, I think that these 3 are going to take enough time and strategic planning that we're going to focus on these, and then the others, of course, are going to still be on our radar, but we're going to focus our efforts here. So Terry did a good job helping us to identify what we want to move towards. Anything you want to add, Paul? You attended the meeting.
You'll see you've got the copy of the minutes, and you'll see how, again, all the different providers and et cetera that was there. I was impressed with the outcome. A lot of good ideas that were around, a lot of good questions. Again, thank you, Terry, for doing that. I did a good job. Kind of gives us an idea where we want to go, what to focus on, and this is what the input from everybody, and that's what we got. And that's how I plan to move forward. So.
Question for you, Dennis. The question that came up last week when we had our discussion is, has the state designated the access centers? And I don't believe that they have. And who does designate those access centers?
No one designates them. All it says is that they're supposed to be geographically located within the state. That's all going to be based on finding providers who are willing to provide the service.
Mm-hmm.
So there has to be supposedly a minimum of 6, and like I said, scattered across the state.
Is this one that had like 120 mile
Yeah, and it's
radius? That they want?
no individual shall be more than 120 miles or 2 hours away from the service. And the access centers can't be larger than 16 beds.
Cannot be larger?
Cannot be larger than 16 beds.
And then I also included in your packet a definition of the services so that you kind of familiarize yourself with what we're looking towards, and it was the same handout we provided at the meeting last Thursday.
I think it was really helpful, and I asked Dawn to provide that all to you guys too, just to have clarification. I know we talk in a lot of acronyms and things, but kind of get an idea of what we're talking about there. So. Yeah, it was Terry kept us under, 4 hours, I think, that day?
Yes, easily. I was concerned it was going to be done in 15 minutes.
Yeah, I think if he had his way, it would have been. But no, I think it was good. I see a lot of faces that were at that meeting, so thank you all for coming to that as well. So,
good.
Is there any other comments anybody else wants to make on that meeting? Okay, that's where.
Before we adjourn, I just have a question. What are you all thinking in terms of decisions on the proposals that were presented today? I know we're setting our budget target. Do you want to have this on the agenda for our next meeting for action, or do you want to look at a later date?
So you're asking about the,
Proposals that we discussed today between Sonoma Home Counseling Services and Plains area. I guess I'm thinking that we should probably move this along because there's still a lot of decisions that need to be made, and as we work out the details.
well, these were all factored into the budget.
They
though, right?
were, but you still have to take action on the request.
Okay, well,
So-
do you want that as, are you guys ready to do that today? Do you think we should do that?
I didn't list them as
Oh,
action
okay.
items, and so I think the way it was handled was appropriate, but I think that if you want this on the agenda, I just need direction in terms of your time frame.
Well, we would
That's
need
your
to do that
recommendation.
before we could ever approve a budget, correct? This would be the next step on these new
We have done projected budgets before we've even done our contracts with our providers. And at that time, we've had, because of our fund balance, the ability to make decisions even though our budget's been set. So I think it's fine for us to set the budget with these targets included in there. And then at a later date, we can make the decisions on what's going to be funded. But I do think we should do it at our February meeting to kind of expedite the process and get some of this moving along, especially for the providers who have their own budgets to be concerned with, so.
If that's your recommendation, I'm fine with that.
Okay.
Put on next month's,
Okay. Sounds good.
we're comfortable we have this covered under the budget or the numbers we approved today, so. Okay, when do you guys want to meet again?
July.
You can call in. I think we should go to Fiji with you, but
Who's going to Fiji? Can I get some of your stuff?
no, I just was wondering if you could get us all a pen like that.
Oh, I have to talk to Louise.
The fourth Wednesday in February is 27th.
When?
27th.
I won't be here.
Neither will I.
The 20th, if you want to go up a week, or do you want to,
That works.
Wednesday the 20th? Same time, 2 o'clock?
2019 at 2.
Yep.
Isn't that the day that we have?
That's in the morning.
Okay.
Okay.
February 20th?
2 o'clock.
Not 2:30, 2 o'clock, okay.
Yep.
We did have a late sneaky. We'll let you introduce yourself then.
I'm Carl Gore, Calhoun County Supervisor. I'm alternate for Scott Jacobs, who had to be somewhere else today.
Okay. And you were elected to the board 2 years?
Yeah,
ago?
this is my second year.
Okay.
So.
Good to have you
No,
here.
it's going on my third year.
Yeah. Good to have you here. Thank you. Okay. All right. Well, we're adjourned. Or do we need a motion?
Just had a motion.
All right. So I'd like to just get it on.
I'll make that one.
Okay, very good. Thank you. Thanks, Dennis. All in favor, say aye. Aye. Motion, we're adjourned.
County County.
Out of county, Carl.
Thank you, guys.
Come on, new opportunities. Congratulations, a new member. Congratulations, the chair.
Each one of you guys. Thank you. Yeah, good seeing you. Thanks. Yeah. Thank you. Take care. All right. Okay. Oh, did you shut the recorder off? Carl? Okay.